we are group 1. Our case study is to analyze a business model of Smart Tooth, a revolutionary solution to automatically analyze carb intake while eating. So this is for patients with diabetes who suffer from an enhanced insulin resistance, which can ultimately lead to a loss of their ability to produce insulin within their body. So to bridge these shortcomings, the artificial pancreas promises a great contribution to the patient's perspective of leading a nearly normal life again. However, until now, the algorithm of the artificial pancreas do not process information on the exact amount and composition of the food the patient is consuming. So here comes the Smart Tooth, which adds to this missing piece of information and closes the gap. The Smart Tooth is mounted to the patient's teeth by a dentist and provides detailed information about the food intake, as it is extremely important for diabeticians to eat healthy and measure their carbohydrate intake. This solves an essential problem for the patients with diabetes. I will discuss the business model, the outline of the business model, and the resource perspective and the market perspective. So first, who are the value creation partners? In this case, artificial pancreas manufacturers, because we need to combine the Smart Tooth technology with artificial pancreas in the patients. Diabetologists and dentists. Of course, the dentists are implementing the Smart Tooth to the patient's teeth, and the insurance companies, because we want to cover the expenses for the Smart Tooth through the insurance of the patients. The key resources and the core competence. The key resources are knowledge of diabetes and relevance between diabetes and patient diets. Clinical experiment resources and experience, existing distribution channels, core competencies, researchability in diabetes, education for doctors, dentists, and sales staff, and capability to reach for medical approval. Next slide, please, for the market perspective. So our unique selling position is the better life for the patient, which is the most important. So improved calculation for insulin injection. This will release the patient from thinking about diabetes. So it will reduce the workload for blood tests. It will measure the amount and composition of food intake, so they can be sure that whenever they take different types of food, the artificial pancreas will release the exact amount of insulin that is needed for the heavy or not so heavy light meal. Detect eating habits and eaten carbohydrates. And it's also connected to a user-friendly smartphone app. The target group, as I mentioned, are diabetes patients. Also, artificial pancreas suppliers. As I mentioned, our Smart Tooth is connected with the artificial pancreas, and the dentists who are supposed to implement the Smart Tooth to the patient's tooth. How are we going to create a customer relationship to exchange with physicians, social media interaction with patients, and the sales channels, of course, direct sales via physicians, because they are the first person that the patient are connected with, especially with the insulin disease and condition. And the App Store for Smart Tooth freemium application. So we will be in a constant communication with the patients. Next slide. Thank you.
Here we are looking at the business model framework conditions. Basically, we will be comparing the traditional pharma companies with the digital pharma companies. starting from the R&D subject, so in traditional pharma companies, we are dealing with substances for the treatment of diseases. Comparing the competitor structure, I mean, traditional pharma companies, they know their competitors, right? It's all the chemical giants who are also making pharmaceuticals. Now, if we enter into digital pharma, of course, and this is not only in pharma, this is in any type of company, this is also in compressor technology, I can tell you. Now you are dealing with an enormous amount of unknown new competitors who are software companies, who are people dealing with standards, communication standards, electronics, everything is coming now together. And this is not the typical knowledge that the pharma companies would have. And this, of course, from an IP perspective, is quite a big challenge. This is what's called here the unknown heterogeneous competitive environment. On the typical product and the patent structure, so traditional pharma, we know, okay, you can have for each product, you have a patent or maybe a few patents. Now, for a single product, you will have this whole, and this is what Alex already mentioned and why I thought we covered this slide, actually. Now, on the single product, because you implement so many different technologies in the single product, you can have a huge portfolio of patents relating to a single product. So also there, it requires quite a different approach from an IP point of view if you move into the digital pharma.
Regarding the strategy we have to put in front of this in IP. So as we said, in traditional pharma, you try to protect the whole product, like you have few molecules and you protect these molecules and it can cover the whole drug treatment itself. The only thing that need to go through medical approval, so it can take a few years. Let's say that's it. So you need to have a large portfolio regarding all of your products. You need to have some patents that create some barriers to just let your competitors out. And you have to go for infringement. If you see that few competitors try to counterfeit your molecules, you have to be aggressive. So that's typically the fortress monopoly. On the other hand, in digital pharma, it's quite impossible to cover everything. Like we said just before, there is a lot of new technologies, lots of competitors, lots of new features that you have to take into account, and you can't put patents on each of them. If you go through software, for example, you can succeed achieving different feature with different software. So you can't protect your feature of the software because someone else is just going to do the same thing in another way, but at the end, same result. So that's quite difficult. So you have to look at what really wants the customer and then try to put your IP around this just to be customer oriented. You really have to create a dedicated portfolio to obstruct as much as possible, as we said, competitors regarding the feature itself, to describe it as much as possible. And that's the value added monopoly.
There are some differences regarding traditional pharma and digital pharma, and this difference regarding the IP strategic implication, benefit, organization, and regarding the strategic implication, in the traditional pharma, there are large portfolios, market barriers consisting actions against infringement. And regarding the benefits of the traditional pharma, is that there can be the protection of return on innovation and avoiding infringement by extensive patenting on one's own, and there are also market entry barriers for potential new competitors. And those are, as we know, the characteristic of the fortress monopoly. And on the other side, the digital pharma is connected to other implication, which is based on the value-added monopoly. And of course, as we know, this is based on protection of user relevant features and strategic patents to obstruct competition and fast documentation and protection. The benefits of this is cost reduction, optimize IP portfolio aligned to business strategies, and profit contribution of single IP assets when they become visible. And this is based on the differentiation center.
With the typical organizational structure of the traditional pharmaceutical company, as a protection center, the IP strategy developed is early protect of all the promising new substance or composition. So the typical process user are IP management and R&D department. While the digital pharmaceutical company, the typical organizational structure is differentiation center, which are related to a single business model and an innovation project or business model analysis, setting concrete IP related targets, and typical process product manager, marketing, IP management, and R&D department. For the patent application decision with the protection center, the traditional pharmaceutical company, the decision is made basing on the assessment of future prospect of the new substance to target disease or the potential effect of the patent composition in the future. If the future prospect meets the target, the patent application can be filed. While in the differentiation center, the digital pharmaceutical companies, if a patent application decision is made based on the fit with the company IP strategy and focus on the creation of exclusivity to customer benefits. In the smart, such as in this case, in the smart tools, is the increase the benefit is the increase the performance of insulin treatment to improve the patient quality life. The patient may have feel comfort as they no longer have to think about what exactly they eat before the meal. Then for the competition monitoring, the protection center will conduct the market observation for similar product or substance, and so they will to detect the infringement. While the differentiation focus on the similar customer benefits, which including such as the second use pattern to treatment of disease using a known substance. Yeah, this is very popular technical term in pharmaceutical industry. And in this case, the new using methods of insulin to diabetes patient. Yeah, that is for the group 1. Thank you.